Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new, please make sure to hit that subscribe button to stay updated on hair loss and hair transplant topics. Visit my website at hairliciously.com to purchase your microneedling devices, which are scientifically proven to stimulate hair growth. My low-level laser therapy cap, hair growth vitamins, the HT blocking shampoo and serum, and a few other products for those who are suffering from hair loss. In today's video, we are going to be going over another incredible hair regrowth transformation from using finasteride and minoxidil. This guy who goes by username DanielCoral36 on Trestless, which is, as you guys know, Reddit's most popular community for males and females suffering from androgenetic alopecia. And he posted his before and after results of just 4 months of finasteride and 3 months of minoxidil. If you actually read through his post, he was also using a 1.5mm microneedling device here and there. So basically, the only thing that he would really be missing in what we would consider the conventional big three treatment when it comes to treating androgenetic alopecia is the use of ketoconazole shampoo, aka Nizoral. I personally think that they should just call it the big four or the big five, whatever, and just incorporate all these different types of treatments that are known to work. But apparently this guy was just using finasteride, minoxidil, and microneedling. And basically he was another hyper responder to treatment in a matter of just a few months. It's always amazing to see these crazy transformations because, you know, it really shows the potency of a 5-alpha reductase inhibitor with the combination of a growth agonist and then microneedling to stimulate growth factors. I will say that not everybody is going to respond to the extent that this guy had, but it does encourage a lot of people who are hesitant to use conventional treatments like finasteride and minoxidil, and also to be consistent with treatment because, you know, there's a lot of people who give up way too early, especially when these treatments can take upwards to months and maybe even up to a year to really start showing improvement. And especially for minoxidil, because you have to get past the shedding phase before you start seeing regrowth. And a lot of people freak out and they just stop cold turkey because they think that the treatment is not working for them. So this guy does share his 4 months of finasteride and 3 months minoxidil results. Notice the relatively short period of time of using treatment before he was actually able to see some pretty extensive hair loss recovery in the next photo. If you actually scroll down to some of the comments, he also mentions his use of, like I said, a 1.5 microneedling device here and there with, I guess, no real consistency, but you know, it's obviously better than not using one at all. And from this photo he provided, we can see some pretty severe diffuse staining to, you know, the frontal and mid scalp, as well as staining on the crown. I believe he stated that he was 27 years of age. So given his extent of hair loss at his, you know, at age 27, he's likely to lose a majority of his hair and head towards a number 6 or number 7 had he not intervened with hair loss treatment. I'm also going to add that he noticed diffuse staining and hair loss on the crown ever since he was 18 years old, but the hair loss suddenly accelerated towards the end of 2020 and basically came to what he has in this photo. Now, moving on to his after results 4 months later, we can immediately see a guy who is literally no longer suffering from hair loss. And let me just tell you that 4 months is incredibly early to see this much improvement in density. His hairline basically went back to a number 1, straight hairline, extremely dense, and you can't even see through his hair anymore. And chances are you won't even notice that this guy was even suffering from hair loss previously. It's really just incredible just to see how much, you know, how well he's responded to just finasteride and minoxidil. And if you also look at his crown, there's a lot of good density that has improved. It's not perfect by any means because you can kind of see right through some thinning going on, but compared to what he had before, I think this is literally a complete reversal in hair loss. His hair length also appears to be a little bit longer than what it was previously in the before photo, but either way, you know, this guy has seen so much improvement that it just blows me away and just amazes me how well that, you know, certain people are hyper responders to hair loss treatment. The other thing that I wanted to point out is the fact that both of the before and after photos that were taken in the same bathroom under the same lighting conditions using the exact same phone. And I'm assuming that there was no windows because I don't see any natural lights, you know, permeating through. And a lot of times, you know, these people who post up before and after results, they post, you know, these photos in different lighting environments, which really affects the way that the scalp looks. But this guy did a great job, in my opinion, in capturing the exact same conditions of his before and after photo. Now, scrolling down through the comments, he actually specifies, exactly what he was taking. As some of you guys are already aware, finasteride and minoxidil both come in topical and oral forms. And depending on which one you're taking, for example, for hair loss, especially minoxidil, it can actually result in significant hair growth. And surprisingly enough, this guy was actually taking oral finasteride for 2 months and then 1 month on topical Rogaine, which is minoxidil. And then out of convenience, he decided to switch to finasteride, minoxidil, and biotin using a pill that has all of the 3 compounds in just one pill. Specifically, the dose of each was 1.1 milligram of finasteride, 5 milligrams of minoxidil, and 1 milligram of biotin. And I'm not sure why finasteride was set at 1.1. He could obviously get by with just maybe 0.5 milligrams. But we now know that he was taking 5 milligrams of oral minoxidil, which is a very potent hair growth agonist when taken orally. Because it goes systemic, unlike topical minoxidil, which is applied directly to the scalp. He claims no side effects whatsoever, yet cautions people to do their due diligence in research because he knows about the potential side effects linked with taking oral minoxidil. So, having said that, let's just go ahead and talk about oral minoxidil for a second. Oral minoxidil was actually used under the brand name Loniten for the treatment of hypertension, high blood pressure. People who actually used it saw a side effect of having hair growth all over their body. And ever since then, it's been prescribed off-label for various doses, usually between 0.5 to upwards of 10 milligrams per day for treating hair loss. Most people who are taking it are going to experience significant hair growth on the scalp as well as various areas in the bodies. Studies showed a significant increase in total hair count from baseline, and it actually works multitudes better than topical minoxidil because the oral form, like I said, goes systemic. To give you guys an example of how well oral minoxidil works, this is a photo of a guy I found on Hair Loss Talk before taking oral minoxidil and then after taking oral minoxidil. The difference, as you guys can see, is day and night. There's significant regrowth on his temple. So with that said, it's a no-brainer that oral minoxidil works, but a lot of people are still hesitant to take minoxidil in oral form because of some of the potential severe side effects that it can cause. Typically, these side effects, would be more geared towards people who have pre-existing cardiovascular issues or people who are at risk of severe hypertension. And although these side effects are experienced in a small, minority of users, these are side effects that can literally kill you indirectly. So most people tend to stick with FDA-approved hair loss treatments like finasteride and topical minoxidil. Although, this is also another controversial topic when we talk about things like finasteride causing suicidal tendencies and depression or whatnot, but that's just going to be a topic for another video. So chances are, I think that this guy who was taking finasteride and oral minoxidil that saw incredible results in just a short span of just 4 months was most likely due to him taking oral minoxidil. And obviously I can be wrong because I've seen others who saw incredible results from just taking oral finasteride and topical minoxidil. But when I see most people who have incorporated oral minoxidil into their hair loss treatment regimen, most of them seem to have some significant improvement in hair regrowth. It's almost to the point where, oral minoxidil by itself would outpower and override the results of finasteride, although they work in 2 different mechanisms of action. But I think oral minoxidil is so potent to the point where if you were to just take oral minoxidil by itself, it can very likely continue to sustain hair regrowth. Taking a 5-alpha reductase inhibitor, finasteride, as it was in this guy's case, is smart for him to do because he's literally treating the root cause of hair loss, which is from DHT. So overall, this guy literally hit the jackpot when it comes to hair regrowth. Now, would I recommend, oral minoxidil into your hair loss treatment regimen? That's something that you guys would have to think about. You guys have to weigh the pros and cons, but I will tell you that oral minoxidil works extremely well for most people. And if I were to ever consider taking oral minoxidil later down the road, which I honestly don't think that I would, but you just never know, I would make sure to at least get, blood pressure levels checked often because if you have normal blood pressure and you take a medication that is meant for hypertension, it can result in hypotension. And even, I would look into getting testing done to the heart, go see a cardiovascular, doctor because it can potentially cause heart issues. And reading through the comments, there's a lot of people who are skeptical of this guy's results. And I honestly don't blame this guy because, results like this don't come, across all the time. Hyper responders are some of the few that are lucky enough to see some significant regrowth from just mainstream treatments. I've seen a few people who saw, crazy improvements from finasteride and particularly minoxidil and microneedling. So they are a rare breed, but I think it's always a motivation to hair loss sufferers to try different, hair loss treatments and different combinations and see what works really best for them. I'm really happy for this guy because he's literally reversed his hair loss in a relatively short period of time. And he did this without having to do a hair transplant. I actually expect him to see better regrowth over the next few months of continued treatment. And hopefully he's gonna give us another update in another Tresses post. But that's all I have for today, guys. If you guys like the content, give it a thumbs up. If you have any questions on hair loss treatments, or if you've actually taken a similar regimen incorporating oral minoxidil, please do share in the comments and let us know what your results were from it. And thanks for watching, guys, and I will talk to you guys in my next video. Take care.